site proliferation and stimulation of the nucleoside differentiation. Okay. So can you go down to capsaicin is the position repair, nucleoside position repair, right? Because that's a risk factor.
So we both left after we had a tragedy. We lost SALWAN'S father. So we left Iraq and went to Jordan in November of 2006.
Okay. We
both practiced medicine. So I was a pediatrician. I got the opportunity to work in an OBGYN hospital. And SALWAN was a cardiologist, and he was working as a physician and one of the internal.
We chose the United States because the United States as a country was founded on immigration and founded on the principle of that we are all were born equal and we have the right to pursue happiness, and we wanted to provide that opportunity for our kids.
It's the land of opportunity, so we wanted to expel our knowledge as well too. So currently I work as a clinical research coordinator with St. Luke's Hospital in Boise, Idaho. I'm responsible for one of the major breast cancer screening trials that we have, which is called the TMIST trial.
I work for St. Luke's Health Partners as a clinical integration manager. My focus is improving utilization for emergency department and inpatients.
So my father was a physician himself, and he did his research on the hepatitis B medication, the zidovudine, and came up with a new medication that has less side effects, more potentials, and he discovered that medication and they named it after him, lamivudine. So when he got back home, he was actually punished for having a PhD. So coming back with a PhD, he explained that he did his research on a medication and was willing to name it after the former president Saddam Hussein, but he actually got punished for that. Saddam said that we don't want people that can hold a pen and discover scientific things. We want actually people that could hold a gun and a rifle. And Saddam punished my dad by sending him to the actual Kurdish area, which was in a war at that time. When he entered the palace, we were just praying that he comes out, because we've heard a lot of people that go in there to meet with Saddam and never get out.
I'm originally from Iraq. I came to the United States in December 2009. Yeah, so I stayed transitionally in Syria, and then after that we had the opportunity to come to the United States as refugees. I was trained as a general surgeon. I'm working as a medical interpreter, mostly with St. Alphonsus and some other clinics in the valley. Depends if we do those tests, 3 tests yearly, like as soon as we can pass those tests and then get the residency done here. Probably we will be able to practice as a physician here as soon as 4 or 5 years.
So you have to be in the top 3% of the country to be able to go to medical school in Iraq. So unless you are really passionate about it and you really want it, there will be, like, your chances really slim to none. We didn't let go of that dream. Being a doctor is who we are. It's our identity. It's something that defines us. Failing to do so in the United States, you just fail yourself, basically. Fail your dream, fail your family, fail the expectations that you have for your future and career.